Good afternoon and welcome to our Evolution Setup webinar session. My name is Caroline Birkinshaw and I'm one of the training team here at Medtech. So today we're going to cover the some of the setup options in Evolution at pretty much a basic level and explain some of the fields that go with those setup options that you might have, which you may have not explored in the past before. If there is anyone here who came to yesterday's Medtech 32 webinar, you'll know that there was a technical issue, to put it mildly. That webinar will be re-recorded and will go up onto the Insight webinar library early next week. So to jump straight into this setup, because there's probably quite a lot to cover, we're going to look at accounting setup, appointment template setup, outbox document setup, recall screening setup, and setting up a new local read code, and setting up keywords. So I've got Evolution open here, and now some of you won't recognize this little button that I'm going to click on in the top left-hand corner. The File tab that you will be used to using has been removed. This is coming out in version 4, which is not very far away. I believe it's just a few weeks. So you'll get the full release notes, which will explain the changes in version 4, but you might just notice the odd few little differences as we go through it. So I'm going to click on the button and down to options. And once we click on options, everything is the same as it is now. So the first thing we'll have a look at is the accounting services. So looking at some of the fields that are available for you to use within when you're setting up a new accounting service is going to new. So we'll give it a code. So I'll just call this one test. So when you're setting up a new accounting service, you obviously need to give it a code and a description and a service fee. So this is how much you're going to charge the patient as a co-payment if the service does not have a GMS or ACC claim component to it. So the consultation, the consultation service code and the CACC and the AGPN are actually quite different, and we'll cover the differences once we've been through this one. But this service code is going to assume that there is no claim component included in it. So this is the amount that the patient is going to pay for the service that we are setting up. Now, if you're setting up new services and you don't want to come in on a Sunday afternoon so that they take effect on Monday morning, you can create an effective date. So if I was setting this service up for a couple of weeks' time, I can put in that it's $40 in here, and I can put the date that I want it to take effect. So let's say July the 1st. And also, if you are updating an existing service, accounting service, you can put your new fee in here. So if it was going to go up from $40 to $45, you can put your $45 here and the day that it will take effect. So this saves you from having to have a mad panic rush at the beginning of the month that you've chosen to increase your fees. You can apply this service code to all your locations if you have multiple locations, or just the single location. So I've got 2 in here, so I'm going to apply them to both my locations. I'm going to add it to a service group. So if it's a service that you're providing, then it would be under services. And here, if it was an immunization, you might put it under immunization. And if it's a consumable, you would put it under the consumable groups. Most of your accounting codes will be for services that you provide. Now, if I put a provider in here, say I attach Jack Dawson to this service code, then only Jack Dawson can be invoiced. So if I try to, if I go to F9 and in my service provider field on my accounting screen, invoice screen, if that was anyone else other than Jack Dawson, this screening code would not be visible to the person entering the invoice. So it's very useful for some circumstances, but if you do accidentally put a person in here and nobody can see the code, then that would be something you'd want to check to make sure that that wasn't done accidentally. If you are, for instance, setting up a service code for a service that you have a finite date for, so maybe, for instance, your PHO has provided some funding for you to deliver a service, and it starts on a certain day, or the funding for it starts on a certain date, but it ends on a certain date as well. So they're not going to pay you after that date. So that will be useful here to put in a start date and an end date. Then you can't accidentally create invoices outside that period. And the provider type is a very useful field to put in. So if this service code only applied to GPs, then I can select the GP group to put this service code against. Again, it prevents front desk staff accidentally invoicing for someone outside that provider type. So a nurse, for instance. In some cases, some service codes can apply to nurses and doctors. And so you could select 2 providers that this service code would apply to. It could be someone completely different. So a specialist in your practice, if you've got specialist invoicing. So then it would prevent any of the GP type codes from being used accidentally. How you determine how that works, because some people I've known have set this up correctly in the accounting services, but it doesn't actually work in practice. And the reason for that, I'm just going to come out of here, just save that, come back to it in a second. Oops, in options, staff setup, we're going to the staff members for, let's say, a doctor. Oops, she's a nurse. It's confusing. So there, I'll go to a GP. In the tab that says provider/ACC forms, the provider must have the correct provider type selected in here. And sometimes when you're setting up a new provider quickly, this can actually get missed. The default setting is for a general practitioner, but if your provider type is something other than that, then you need to select the correct option in here. When that is selected correctly, then if you select the provider type when you're creating a new service code, then it will be, the service code will be limited to the provider types in that selection. Here's my test. Search. So there we have it. So I say, so long as the GP provider type is selected, then only the provider types in that group will this service code apply to. Quantity-based service is for when you are setting up a service code for consumables, for instance. If you wanted to set up a service code for crepe bandages and you wanted to often sell 2 of them at a time or 3, then when you do your invoice, and if quantity-based service is selected, then you put in 3, then it will default to the cost of the 3. So it would be 3 times 40 in this case. And units would be the correct option to choose. You could be setting up a service code for distance, in which case it would be a quantity-based service applicable to kilometers. And if it was a time-based service that you were setting up, then $40 would apply to a specific amount of time that you select in your invoice. You would tick this if you're a capitated practice and this is a non-capitated service that you're setting up. Apply as a percentage is a strange one. I've never seen a practice use it. In 30 years I've been working with Medtech 32 and Medtech Evolution. I've never seen it applied. Somebody must have asked for it very, very early on in the days, and I've tested it and it does work in a degree, but it doesn't actually give you you can't still apply a percentage discount to a service code. So I can explain it to people who want to use it, but I'm not going to do it today because I don't think anybody ever has wanted it. A fixed fee is for a $40 fee here, which cannot be changed. It cannot be discounted down to 20, and it cannot be increased above 40. So if you want to make sure that always when that invoice is raised and it's always the correct amount, then you can apply a fixed fee here. If this is a non-consultation service, then you would select that it is a so for instance, a repeat prescription and all your consumables, they would be non-consultation services. So there's no direct interaction with the patient, either through a consultation or through a telephone consultation or a video consultation. There's no direct interaction with the patient. And for trigger treatments, this is for physiotherapists and chiropractors who are restricted to a certain number of invoiced services for a injury, and Evolution will count down the number of times you've used that invoice for that patient. So that's a sort of idea of what all those little boxes mean. Looking at the tabs going across, we have an annotation tab, so we can annotate our invoice. We can annotate our service. So on the invoice screen, on the F9 screen, you can invoice individual invoices, but here we can annotate the service. So if you want something to print out every time you use this service code onto the patient's invoice, you can add an annotation here. Subsidy is where the GMS, ACC, immunisation claims are attached to the service code. Now, in 99.9% of cases, you won't ever have to use this, because if the Ministry of Health or ACC request a new service code with a subsidy applied, then it will be released by a Medtech upgrade rather than you having to add it in manually. The GMS adjustment. So this is, I'll close this one for now, and we'll use to explain the GMS adjustment, we will use the consultation screen. We'll look at here. So there's the three service codes: the consultation screen, the ACC, CACC, and the AGPN, which are the most usual ones that use the GMS adjustment utility. So when we go in here, you will see that I haven't set this up, and if you've never used it before, it can look rather daunting. What do you do and how do you do it? So to go with this, when you do have to increase your consultation fees or your ACC consultation fees, you need to use what is called the GMS adjustment utility. This is on Insight. It's in the Evolution resources under in the Insight portal. So if you go in there and look under Evolution and under Evolution resources, you will see the GMS adjustment utility, and you can download it onto your desktop. It's a Excel spreadsheet with a formula inside it. So I have one I prepared earlier, so I've downloaded it and I have it open here. So to use this, let's come into the consultation. So you need to have, first of all, you need to have the right tab selected for the service code that you're setting up. The second thing you need to ensure is that the subsidies are current. So we have the subsidy tab here, and if you look on the website, on the Insight website, you will see that the adjustment tool was updated in May 2021. So it's pretty current. There haven't been any increases in the subsidy since May 21. It's only a few weeks ago. But if there has been an increase between the time that you use this and the time that Medtech have updated the utility, you will need to come in here and change the subsidy codes to reflect the current ones that are applicable to the GMS, ACC, and the AGPN. So that's the first thing you need to check. Coming back to the tab here, the second thing that must be checked is that this service fee here, this $70, is exactly the same as the service code on your main tab. And you can see it isn't, so I would change that to $70. And why? So $70 is a random figure that I've chosen. So normally the fee that you put in here to make it all work really easily is the highest fee that you charge any of your patients that use this service. And in this case, it is likely to be a casual patient A3. So a casual patient, adult with no community service card. What would you charge that patient as a surcharge? So that's the fee you put in here. In the utility, you would put the same fee, and they must be the same. It's not so much important as to what they are, but they have to be equal. And then what you would do in here is look in these three sections. So you've got three sections to the utility, and you only work in the top section. So I'm on the top of the spreadsheet, and I'm working in this top box here. So the first set of fees that you put in here is what you would charge for your registered but not funded patients. Now, I know these days with funding being much faster, it's not a period of time that's very long now. So if you've registered a patient but they are not yet funded, then this is where you would put the fees for those patients, because GMS is allowed to be claimed for them. The fees that you put into this middle section are for your casual patients. So again, they can have GMS claimed for them, but you would be charging a higher copayment. And the third box here is for your funded patients. So the patients that are not going to be getting GMS, a GMS component. So you would simply, in this box here, start at your adult 18 to 24. What would you charge your adult 18 to 24-year-olds? If it's $40, you can put $40 in there. What are you going to charge your 25 to 44-year-olds? If it's the same, it's the same. And you work through these boxes, putting in the fees for your adult A3s, your adult AZs, and your A1Zs. And then come down and put your fees in for your Js, your Cs, and your Ys in each of the separate groups. Once you've completed that, print it off by coming up to File, Print. Take this bottom selection, which is how the formula has been worked out, and apply this formula into your service codes. Come back into here and into the GMS adjustment. Those are the fees that you would put into the boxes here. So it's the same set of boxes: you're registered, non-funded, casual, and registered funded. Once you've done that, then whenever a patient comes to be invoiced, regardless of what age they are or what their registration status is or what their enrollment or funding status is, the fee that comes up in the patient copayment box should be exactly accurate to what you want it to be. So it's, as I say, just a few basic rules around using the template, and it should work fine. There is an adjustment when you go into the Insight tool. There is a user guide that goes with this. So download that as well as your utility, and you'll be fine. So that's the accounting services. So the next one we're going to move into is appointment templates. And we'll look at appointment template. So first of all, when you open the appointment template up, you must select a provider to build a template for. And in this case, we're going to build a template for June, but we can move through the months. If you want to apply this template from into the future, you can simply select a month down the track. And the highlighted box is always today. So we may as well start today, but you can start anywhere you like. It just depends on your provider and when they're going to start with you. So opening it up, we've got a date from when the template is going to start operating. So we can change that date if we wish to, but I'm going to leave it as today. I'm going to put a tick box to say that I want to apply it for the next 6 months. And what this means is that for the next 6 months, the template will always be there will be a template in the future for the next 6 months. And as that rolls forward, it will always be 6 months in advance. So you don't have to come back in 6 months' time and reapply this template. You don't ever have to reapply it unless you've chosen a specific date range. So we can, instead of choosing that option, choose a specific date that this template ends. And that's something you would do for a temporary staff member or a locum. So it's only going to apply for that period of time. So the start time is the time that the provider is going to start seeing patients in the morning or afternoon, whichever. The end time is the end time or the time that the appointment template finishes. So it will be, say, 5 p.m. I'll come back to these 3 boxes in a little while. So the days of the week that you would select here. So if this provider is going to work the same hours or the same sessions on, say, a Monday, Wednesday and Thursday, then you can tick those days. But if the provider is either not going to work or is going to work on a Tuesday or Friday with different hours, then you can leave those 2 blank and come back to those later. The cycle is selected by default to run 1 weekly. So that means that this template is applied each and every week. If the template only applied every 2nd week, then you can apply it by putting the radio button in this 2-week cycle, and so on through the 3 and 4 and 5 weeks. Over here, we have the appointment type. So if this session that we're going to set up is going to be of a specific type, then you can select a appointment type here. But if it's just a general consultation appointments, then leave it blank. The time is the time that you're going to start, which is reflected from where we put in the start time over here. And then we will go to time. So the time that we put in here is the time that the session is going to run until there is a break. And your sessions may run from 8 o'clock right the way through to 12:30, or they may run through till, say, 10:15 when you'll want to put in an official quick break time. So if I put in 10 a.m. here, and my duration of my appointments, I can select here. They can be 30 minutes or they could be 15 minutes, whatever is the duration for your individual appointments. The time is available, and the session name is whatever you want to type in here. Oops. So it's up to you whether you put anything in here. If most places just for a normal morning session would leave it blank, it's entirely up to you. It's a type of consultation is that it is a consultation. I might change this to theatre procedures if it was a specialist practice, but in most cases they are a consultation type. And the location. So if I have 2 or more locations, I could select a different location for this template. We're not going to cover venues and rooms and colours in this particular session. We could look at colour because it's very quick. The venue setup and room setup we would save for an advanced setup session. So I could choose a colour for this session, and all my appointments that I make for that session would be that colour. And the SMS template, which we discussed last week in the SMS webinar, we would select the template here if we were choosing different appointment templates for different times of the day. So when we set up the SMS templates last week, in the SMS setup, we chose an appointment template message. So that's a generic message that will go out to all patients for that provider. But if you're wanting to send a different message in the morning in the afternoon, you could set up and select different templates for the morning sessions or the afternoon sessions, or however you choose to set your sessions up. Medtech will look at what's in here first. If there are templates in here, the automatic SMS reminders would use these templates in that instance. If these are blank, then the SMS or appointment reminder will use the template that's set up in the SMS setup. So it's not necessary to have a template in here. So we would then add, I'd got rid of that message. And we would add a morning tea break, for instance. And that appointment, that session is the provider is not going to be available, and we would only give him 15 minutes, or you could give him 30 minutes. And in this case, we would type in that this is a break or morning tea, whatever you choose to, and the rest is the same. And then we can keep on adding throughout the day until we've built our template up till 5 o'clock in the afternoon. Now, just a couple of little points here. If I set up, if I choose that to 10:15, oops, and 15 minutes, so this will be 10:15. If I chose 10:15 till 12 o'clock, 12 midday, so it should be 12 p.m. and I put in here 10-minute appointments, it won't work, and you will get an error message. And that's because whatever you set up as your duration must fit into the time selection that you have added here. If I try and put 10-minute appointments here, I'm going to be left with a 5-minute appointment that's an orphan. And so therefore the template won't work, and you will get a message to say that it won't. And so if I try and save, actually there'll be a couple of errors here because I've not completed it. So it says that the duration you've entered does not fit evenly into the time range for the template. And when you get that message, it is because 10 minutes won't fit in between 10:15 and 12. So I can either change that to 15 minutes, or I can change my template to have my morning tea till 10:20, and then my appointment template starting at 10:20, and then 10-minute appointments will fit in there. I can add more sessions. I can delete a session if I've made it incorrect, and I can insert another line in between if I've added it and thought, oh, actually I will give them a break for morning to afternoon tea, and I hadn't. So and it will always add it above the line below. And then these boxes down here, if I'm setting up more than one new provider, I can select that provider if they're working the same or similar template to the provider I'm working on in here. So once the template has been built, I can go OK, which I won't do because it's not completely finished. So we'll just look at one that is. Jack had, no, it wasn't Jack, it was this guy here. Okay, so the other little tip that I'll show you that is available in here is we can right click on the template and we can copy and paste. So if you set up a template for somebody and it works really well, I can copy or I can select Control C and then I can go to an empty template and paste that in here. Open it up and then I can apply that for 6 months on the same days or on different days. And that saves me an awful lot of work because I don't have to redo that template when it's the same as one that's already in use. I can also insert public holidays. I needed to have downloaded a file, which everyone got the message about that when it was released last year. Again, if anyone needs that, the document will be in the Insight, in Evolution, in Evolution on Insight, to be able to download that file of the public holidays for the year and the school holidays, and then you can apply that to your template. Now, I did say I would go back and talk about these 3 fields here. So what this field, the first one, the special field, all that does is indicates that this is a special template. So I've come in here and I've changed that 9 a.m. to 10 a.m. So therefore I would make it a special, because often in a practice there's more than one person looking at the appointment templates and changing things. So if somebody looked at this and saw that I'd made it 10 a.m. without marking it as a special day, they might think that I'd made a mistake and that, oh, why is he working at 10 a.m.? Somebody's made a mistake there, I'll change it back to 9 a.m. By marking it as a special day indicates that it is a special template for that day. Marking it as a day off is self-explanatory. Let's take that out. So that just marks that as a day off. And I can copy and paste those days off if it's for a whole week. And the third one is prevent any bookings. So if I flag that, then for this day, no further appointments can be made. So if there are appointments made on that day, they will remain there, but no further appointments will be made in that appointment template for that day. And there may be various reasons why you'd want to apply that. And then a message will come up if you try and make an appointment to say that this appointment template has been flagged as preventing any appointments. So that's what those do. So we'll keep pushing ahead. Oops, need to come out of there. So we'll have a look at the in-outbox setup. So I think a lot of people are very familiar with this. So we'll go through it and, as I say, look at some of the fields and what they do and why you would apply them. So if you were setting up a new Outbox document, again, you would give it a code and a description, and you would put it in a folder. So it's probably easier to look at one that already has been done. So we'll look at this one here. So you've got to give it a code and you've got to give it a description and the folder that it's going to go in. So as it's an Outbox document, it's going to go in the Outbox document folder. The options are hard coded in, so you can choose, they're not hard coded in, so you can select different folders to pop your documents in if you wish to, or you can put them all under document. The format is T for text, T-E-X-T. And what T-E-X-T is it's a small, it's the small word pad that comes with all copies of Windows. So it's a small word processor that you don't have to install a separate word processor to use. So it comes with Windows, doesn't cost anything extra. It's a very simple a word processor. It doesn't have a lot of formatting functionality, so it's not the same as Word. You can, however, choose to set your document up as a Word template. And that will take you into your copy of Word if you have Word installed, either on your server as a cloud option as Word Office 365, or if you're using a desktop computer that you have Word or Microsoft Office installed on your desktop. We're probably going to be a bit pushed for time to do the Word Outbox documents, but we'll say we can cover Word when we do the advanced setup session. So we're going to keep it as text for today. The other options you would choose is this is an SMS document, or a health document, or a manage my health document. But we'll look at text documents today. We can select a default referrer. So if you have a person that always receives this document, you can select that person from the address book. And that will be the default person that this document always goes to. You can select people from your address book to receive a copy of this document whenever it's applied to a patient. These up to 4 people can be copied in by default. You can select someone to copy the document to on an individual basis when you do the Outbox document, but this is a default. A referral type, if you wish to choose a referral type, they are set up in here. So if this might be a private hospital referral, in which case you can select it as such, otherwise leave it blank. And if you want to apply a cost to the document, how much does each document cost to provide, then you can add that in here. Also, does this document apply to all locations, or is it only applicable to one? Choose your A5 paper. You can print it in landscape or A4, should I say, or whatever choices you've got. So A4, A5. Print it in landscape, or the default is in portrait. If you wish your practice logo to print at the top of your letter when you print it or send it, then you can tick print logo. And you can reserve some lines if you want to add the footer from the location setup, or the footer. Don't worry about these. If you here, then a classification has to be included in the letter. If you tick this, the document is not allowed to be parked. And any of these options can be applied if you choose, so that this document is only relevant for registered patients, or is only relevant for deceased patients, or so on and so forth. So those can be applied optionally. And also a task reminder can be set up by default. So if I select, I want to follow this up in 3 weeks' time to ensure the patient has responded to this letter that I've sent, I can put in follow up and a category if I've set up categories for my tasks. So it's in progress, and it's to be applied to a specific GP or somebody that's monitoring these follow-ups. If you leave this blank, then it will apply to the provider that uses the document template. And you can copy other people into the task as well. Then in the document section, we have where your document is going to be set up so that you can apply this template to any number of people. So because I've selected on the main tab here, print the logo, I don't actually need this merge field in here. So I can take that out. So then you want to apply a number of merge fields so that it will always pick up the correct details whenever you use this document. So obviously today's date is a date that you would want to add to your document. So then you would use this little box here called Insert. And in here are all the merge fields that you have access to. So for instance, we've got patient keywords. The date comes under miscellaneous keywords. So if I look at miscellaneous, then we've got accident dates, but we've also got date of document. So this is the date of document that I've selected, or it will just pick up the date of today's document. So just select the correct field that you want to apply. And then we've got, so in the next line down, over there, we have the patient's pre-formatted external name, patient's home residence, the home street, suburb and city. So depending on what you want to put into your document, you would select the field. So in this case, we've got the patient keywords, and in here you would find the patient's pre-formatted name, preferred name here, and you would find the patient's home address. Type in home, you've got home city here, home residence, street address, suburb. And then it's going to say dear preferred name, or you might choose dear first name, depending on how formal or informal the letter is. So if I put in first name here, then I could choose this name as the name that I want to insert. Once you've selected a field that you want to use and go OK, it will put the field wherever the cursor is. So just make sure your cursor is where you want it to be. Once you've put your merge fields in, you can type the body of your letter. So whatever you want to type your letter as, and you can sign it off with your provider name. So it will pick up whichever name who's doing the document, and if you wish to, your location name. So there's other merge fields in here with your qualifications if you want to add that in, your NZMC number. So those would all be under the correct headings when you look at the filter under the patient keywords. Okay, so once you've finished that, you can OK, and you will need to leave Medtech to make those apply. So just the other quick thing in here is also within the document, you do have some formatting options. So if you want to select your text, you can change the font, you can bold, underline, italicize, you can change colors, and you can do some justifying, add bullet points, highlighters. So there is a few things in there that allow you to use some formatting options without having to use a Word document template. And you can add a page break in here as well. So if you want to add another document in underneath, you can break this and then it will add the other document as a second page. So that's the basics of doing an Outbox template. Then we come into recall screening, and we're just going to look at the recall screening terms and adding a new screening template and what the fields also mean in here. So again, you would go to new, and these are the fields that you have available to you. And it just because it's easier, I'll use an existing one to demonstrate. So I'll use this one. So you've got to give it a code, a description, apply it to a gender. if that applies. So in this case, we could apply a smear to female patients. Or if you want to cover all your options, you can use it all, it doesn't matter. Screening is the group that we are applying this template to. So we've got health measurements or we've got screening. And we've got a recall. So whether or not we want to set up some documents for this screening term. So if I'm going to use this on my recall contact list, I might want to apply a recall document and send a smear. Sorry, a recall document is not a text message, but a recall document is a letter. So we would select our letter template from our selection of templates. Oh, okay, I haven't got a smear one, but I'll just pop that one in there for now. So that would be for my letters that I want to send out through my recall contact list. My SMS document, so I've got an SMS message here that I would apply. I might want to send an email, and so I can apply an Outbox document as an email message. So again, I could use the same message as in my letter. If it's the same, it probably wouldn't be very much different. And for manage my health recalls, you would select a manage my health letter. So we've got default outcome. So in here, from our list of outcomes, what's the most likely that you're going to be, what's the most often used outcome? So perhaps normal is one that you would find is the most normal. If you don't think that there is an outcome that's used more than another outcome, you don't have to put a default outcome in here either. If this normal recall has a specific period that you would, if this screening term has a default recall period, you can set that up in here. But if it's done by outcome, then you would set the default recall period up in the outcomes, and I'll show you that in a second. You can choose not to upload this whole template up at any time for any patients onto Manage My Health. And I can set up task reminders in here as same way I can in my Outbox document. So if I'm asking a patient to do something by sending them this letter or this text message, I can set up a reminder to follow it up in any given period of time. And then we have measurements. So in this one, don't usually have it's usually just an outcome. So let's look at outcomes. So we've set up various outcomes that can apply to a smear recall. So these are the ones that are advised by the Ministry of Health. So you can add other outcomes. So you can add an outcome in here, and again, choose your code, your description, what period of time you want this recall added applied to. You can set up an outcome indicator. So does this outcome indicate that the patient's result is abnormal or invalid or normal or exempt? And again, you can apply specific letters and text messages to this screening term, and a service code if that applies as well. Okay, so you can see that if we've got a normal, we've set it up so that we recall in 3 years and the result indicator is normal, but I haven't set up a special message for this particular outcome. I'm going to use the text message that is more generic that I've set up on the screening term itself. If I want to include any information documents in my when I send my template out, I can apply specific Outbox documents that might have information added to them. It may be, I've got one in here, I think somewhere for the directions to the medical centre or directions to hospital if it was a hospital referral. So you might want to apply, or if it's some specific instructions that the patient needs to carry out once you've applied this screening term, then you can set up a document in your Outbox documents and apply that here. And you can do quite a few of them and apply a number. Okay, so that takes us through that part. And then the other part of setting up a screening term is adding measurement values to your screening template. So to do that, we're going to have a look at a very simple one in this first instance, which would be blood pressure, just to show you what it would look like. So this one has had measurements applied, which in this case is the systolic measurement and the diastolic measurement. And so if we view one of these, we've given it a name, and it's a text. So actually it's not, it's a number. So we're going to put in a number here. Now it's got 8 characters. So it is quite important, particularly when when you're looking at GP to GP, if you have errors and you put text into a field that only should have numbers in it, then it spits your screening term out when you try and send it through GP to GP. And also if it has incorrect amount of characters in it. So with a systolic measurement, 3 characters is the maximum that you could put in. You wouldn't have a systolic measurement that had longer than 3 numbers. So it can have below, so it can have 2, but it can't have above 3. If you've put in a systolic measurement of 1,000 and something, then it's obviously going to be incorrect. And this just keeps the screening terms accurate and prevents typos. So if somebody accidentally adds a digit more than should be, then it prevents you from doing that. So that's quite a useful option to choose, and one that often gets overlooked. If this had units, and we'll have a look at those in a second, you can type a hint in here. So if this was more complex than a systolic prompt, you can add an explanation as to why you would put this measurement in here and under what circumstances. Add the systolic. And then, so whenever somebody hovers on the prompt, you can see the print, like you can here see where it says minimum value, you will see a hint that gives you a bit more of an explanation. So in here, you can add a valid range. So a systolic measurement would probably, I think the patient might be dead if you put in anything lower than 10 and higher than 100 and higher than 200. So that might be a valid range that you would put in for a systolic measurement that could be added. And again, if somebody tried to type in something 300 or 400, it would prevent them from doing that. So again, it reduces the opportunity for typos. Default data means that it can be added by default by mapping. We're not going to cover mapping in this session because there just simply isn't time, but we'll save that for an advanced session. But the mapping will be limited. So if you're mapping a result from one screening term to another screening term, if it was older than 3 weeks, it wouldn't map. You can tick that it's a required field. So if in the screening term, the measurement was required and you couldn't save the screening term until you'd added a measurement, then you can put a tick in here. And update means that you can add a separate new measurement if there's one that applies. And this is tagged into the mapping. So we'll cover that when we do the mapping session. So that's how to add a screening measurement. So areas where you would add measurements to a screening term would be things like your lipids, where you would have your HDL and your triglyceride and LDL. So then you can add all 3 into one screening template rather than having them set up individually. just a quick look at the diabetes project. I know not a lot of people use this anymore, but this is a very good example of how big a screening term could be, a screening template can be built, because this maximizes the amount of options that you can use when you're putting in measurements. So in the diabetes screening template, you've got up to, I think it's 29 fields in here. So some of these measurements have been set up as combos. So if we open this up, you can select a drop-down list for your template. So people can choose which option to select. So if I click on choices, then these are the choices that have been set up in the template to use. Oops, quite a few of those have been playing around in here. So you would add a choice, and in the drop-down menu, just a description is all that's necessary, and you can, so just added a term here, and then you've got the drop-down list for people to choose when you apply this template. You can select a number, so it can be a data type of a number, and again, as we talked before, select the length. It's up to 30, so it can have up to 30 characters. Some of them will be text, so instead of a number, you would put text in. I can select text here. So if I put in text, then I can just free text whatever I want to put in here, again, up to 30 characters. So that's the maximum number of characters that you can put into any one field. You can choose tick boxes. So we have tick box here. So this one is set up as a mailing list, and tick, yes, it's set up as a mailing list, or tick, yes, that the consent has been given. I can set some of my fields up to collect NHI numbers, and so it will only collect an NHI number. So if I try and put a formula in, if I try and put any other type of number in that's incorrect, it will tell me that that's not an NHI number, because there is a specific formula for import, for adding in NHI numbers. So most of these are combos, but that sort of, and dates, you can add a date field as well into your template. So I haven't got on, but we could, and a decimal. So if it has a decimal point, then you can add again, like here. And date is the other option that we didn't add in. And you could choose a classification option too. So the diabetes, well, if you're wanting to build a decent size screening template, but you're not really quite sure how it's going to look or how to set the measurements up, you can look at the diabetes project one, because everybody has one. It may be inactive, so just look in the inactive options and you'll find it, because it was imported in, it's part of the Medtech import. So, and that's a really good template to start looking at, how am I going to design and build my my screening term. So some of them are very, very simple, straightforward. They just have one field, and some of them can have up to, the maximum is 32 fields. So I hope that's given you a few pointers into how to build a screening template. How are we doing for time? We've got a couple of minutes just to finish off the last two, which are quite quick, which is setting up a new read code. So in File Options, Clinical, we can add a new read code. And these would be local read codes. So because they're not part of the official read code structure, you can add your own local read code. So to do that, you go into read code. Sorry, put you wrong there, into new. And it will check with you, do you wish to add a new local read code? You can say yes. You can then give it a term. So you don't need to fill out the 60 term and the 198 term. It's wouldn't necessarily, you don't really need to at all. Just give it a term. And as long as it's no more than 30 characters. So a 60 term is their number of characters. So if it's over 30, you would need to use a 60 character read term, but you don't need, it's not necessary. And then here you can add your keyword. So you can add as many keywords as you like. So I can add another one. So whenever you're searching for your read code that you're setting up, what are the keywords that people will want to type in when they're searching for it? And you can put as many keywords in as you like and go OK. So it's already defaulted to being a common read code. And if you wanted to apply it to ACC, which is probably not a good idea because ACC really like to use their own read codes, and go OK. When you come to use this, I just click into Arnie a second, and classifications and new and test and search. There's my local read code. And finally, keywords. So there's two ways you can add a keyword. One is in the setup. So if you're adding a lot of keywords, then at the same time, then this is a really good option. So file options, clinical and keyword. And this is my list of existing keywords that I have. So what keywords do is allow you to type in a code, say in this case a cast, into your consultation notes by preceding it with a full stop, and it will then expand that that sentence out into whatever you've typed into the body here. And as you can see, you can type an awful lot. You can build some quite big keyword templates in here if you choose to. So by coming into new, I can give it a code and I can type in whatever is in the body of whatever I wanted to expand out to. Once I've done that and close it, in my consultation screen, I can type a full stop. Where did that go? I don't want it there. A full stop, no spaces, and test in this case, and it's not case sensitive, and then enter. And it will expand that out into what I've put into the keyword. Now, if you're a clinician and you're wanting to add a keyword for something that you've just typed out and you think it's going to make a really good keyword, you don't want to have to go and write it out on a piece of paper and then go into setup to do it. If you've typed it out, then highlight it and copy it. So Control C or right click. I right click and I can copy. Then once you've copied it, click on the end without putting a space in and right click. And you can add a clinical keyword here. And that will take you into the keywords and you can give it a code, test 2, and right click or Control V, and that will add the sentence that you wrote into your consultation notes and go OK. And now that sentence that you wrote is a keyword that you can use again and again, over and over. So those are some quick things to set up for you. So and we've just run over time, which I thought was okay. So now I can invite you to ask questions. We've got up until 2:30. We've got a question and answer session. So you can type your questions in and we'll go about answering them. So I have a question. Is that right, from Helen? Is that message a bug? Oh, no, it's not a bug. It can be cleared. I actually can't remember off the top of my head how to get rid of it, but if you contact our customer support team, they will help you with that. That little message that came up about, I know which one you mean. But yes, it can be got rid of, and I should go about doing it for myself. The error message when you add a new line in an appointment book. Sorry, wasn't very clear. The error message when you add a new line in an appointment book. Sorry, it wasn't very clear. Okay, thanks. Was that the message? Yeah, is that the message I'm talking about, Helen? The one that just popped up about object, yeah, an object format or something. Yeah, just get it. You can get rid of it, definitely. Okay, so sorry about that. I'm waffling a bit, but okay, I think we got there. Any other message and any other questions from anybody? Just a couple of things whilst I'm waiting for any other messages. If you would like an advanced session, or if you would like me to cover, or any of us, I mean, it's not necessarily me that runs the webinars. If you would like a webinar on more advanced options for setup, what would be your top list of options? Because the setup is huge. I mean, we could probably spend a best part of a week going through it, but there's so many tiny details and specifics. So if you can let us know, we will be sending out a feedback option for you. So if you can add in what else you would like, whether you would like beginner level, advanced level, and what sections of the setup would be your preferences, then we can set up another webinar or 2 or 3 in the future to go through those options. But getting some feedback from you makes it more relevant, because we'd rather give you the information that you want than waste your time giving you information that you don't want. In the accounting service, so this is from Araha. In the accounting services and GMS setup chart, in our setup under consult, only our casual columns aren't filled in. Although our fees for casual are different, why would this be? I can't answer why your fees are not set up. What I can say is that you may have set up a different service code for your casual patients. Would that be so? But you don't need to. You can include your casual patients in your consultation as long as you fill those sections in. So some practices these days rarely ever see a casual patient. So they don't, they don't need that. But it's very much a question that's specific to your practice. But if you would like me, Araha, if you'd like me to look into this for you, could you contact me on, and anyone can contact me if you've got questions later. If you remember things that you wish you'd asked a question about, you can contact me on training NZ. So I'll say that again, training NZ at medtechglobal.com. So if there are questions that come up, or you want me to look at something specific within your practice, then send me an email and I'll get in touch with you. Send me either by email, or if you include your phone number, I can come back to you with and look into it more deeply. So Suan asks, what's the difference between a registered and funded patient in the accounting services? So a registered patient, and as I say, it applied more so before the online NES came into action, but there are certain circumstances where you have registered a patient, but you have not yet enrolled them and you have not yet received funding. So the difference is registered patients are registered and no funding applies to them as yet. Funded patients are patients who are registered and funded, because between registering and becoming funded, you are allowed to claim GMS if it applies. Okay. I only have 3 provider types to select from. How can I add more? Pauline. I only have 3 provider types. How can I add more? So where we're talking are you talking, so if I come into File, Options, Accounting, Accounting Service, move this out of the way. So Pauline, are you talking about this box here, provider type? Because this is hard coded and you should have all of those. So do you not have all of those options in your provider type? You can't add more because they are hard coded. Again, if you send me an email, hang on, looking under staff setup. Okay, so let's go and have a look under staff setup. So if I choose general practitioner here. So were you looking under provider/ACC forms? And we were looking under this list here. And again, this list is hard coded. So hopefully you have the same list here as in the accounting services. Is that not so? If you have a different list here under provider type on the first page. So this is the one that is important. So this is where your provider type is linked to your accounting services. So Pauline, can you send me an email with a screenshot of your, so that I can look at it in more detail? If you, again, send me an email, if you put in the subject heading, today's webinar, and put some screenshots in, then I can, and send it to training NZ at Medtech Global, it will be directed back, it will be directed to me, so I can have a look at it. Thank you. How to set up different appointment types to choose from. Okay, so that again is in the appointment section of the setup menu. So you've got appointment and appointment type here. This is a question from Araha. So when you open this up, you can add different appointment types in here, and you can apply a color to that appointment type. Okay. I think that is all the questions I have so far. If I have missed any out, I will be downloading this list of questions and I will get in touch with you if I've missed any. But I think I've answered all the questions that have come through. Great, okay. So thank you all for attending. And this webinar will go up onto the Insight portal under Evolution Webinars as soon as possible. I think our marketing lady is away at conference at the moment, so it may take a couple of days, but we will get those set up. And we're going to, we haven't got a webinar booked in for next week, but we will be reviewing what we've just done and having a look at some of the requests that we've had come in for different types of webinars, and we'll be setting up a new set very shortly. So I look forward to catching up with you all again then. Thank you so much. Goodbye.